Okay, we're going to talk about disorders and conditions resulting from trauma. The major types of trauma include open, which the skin surface may be scraped, torn, punctured, or crushed; assault, which is an attack; thermal, exposure to environmental factors; or psychological. Open trauma. Things you have to consider. Regardless of the type of open trauma, such as an abrasion, avulsion, puncture, or crushing injury, 3 factors must be addressed: the risk of infection, tetanus prophylaxis, there's an initial inoculation series, then tetanus booster every 10 years. And this is a protective treatment, and bleeding. Okay, so we're going to be talking about some open traumas. The first one is an abrasion. This is an injury where the outer layers of the skin, where the outer layers of the skin have been scraped away or roughed up and the deeper layers exposed. They're also called friction burns, floor burns, rug burns, or road rash. Now we get the picture. Okay, so there's an abrasion. See, it's braided away. The next one is an avulsion. This is when a portion of the skin and possibly underlying tissue is torn away, either completely or partially, and can involve soft tissue anywhere in the body. It's usually accompanied by severe pain and bleeding from the wound. The etiology: the body part becomes entrapped. The affected body part becomes entangled in machinery or clothing. Causes skin, tissue, and possibly bone to be torn and pulled away from the body. If a limb or appendage is severed completely from the body, it is termed an amputation. This is an example of an avulsion. This is a 22-year-old female who had avulsed the skin off of her right ring finger while attempting to jump over a spiked fence. Her ring caught on the spike. So that's finger that had been torn off. A crushing injury occurs when a part of the body is compressed with extreme force between 2 surfaces. Most often involves a finger, hand, toe, or foot. Bones, nerves, and blood vessels can be crushed as a result of the injury. Some examples are fingers shut in the door, hands or fingers caught in presses, heavy objects being dropped on fingers or toes. Puncture wounds often result when a pointed foreign object penetrates the soft tissue. Includes animal bites and typically cause pain and very little bleeding. A foreign body protruding out of the wound is referred to as an impaled object. The treatment for puncture wounds: you want to remove the foreign object, thoroughly irrigate the wound with sterile fluid, apply a sterile dressing, tetanus toxoid if patient's vaccination is not up to date, and antibiotics to prevent infection. Okay, this is an example of a puncture wound, and this is a dog bite. That's what caused that. Okay. A laceration results when a sharp object cuts the skin and possibly underlying soft tissue, may be smooth or jagged, and typically cause pain and moderate to severe bleeding. The treatment: wounds should be cleansed with water and germicidal soap. With wounds that are smooth and not too deep, a butterfly dressing can be used. You can also use steri-strips, which are sterile adhesive strips. In some cases, a type of glue may be used to hold the edges together. An example of that is histoacryl. You administer tetanus toxoid if patient's vaccination is not up to date, and administer antibiotics. Antibiotics are administered to prevent infection. This is an example of a laceration. So an incision is a smooth cut, whereas a laceration is a jagged cut. Okay, let's talk about foreign bodies. These are in the ear. They typically range from bugs, pebbles, and bits of cotton to anything small enough to fit in the ear canal. Visualization of the ear canal usually shows an object. The external auditory canal narrows at the bony cartilaginous junction, okay, right in here. Foreign bodies are easily trapped in this area, increasing the difficulty of removal. Attempts to remove the foreign body may push it further into the canal and lodge it at this narrow point. In addition, the tympanic membrane can be damaged by pushing the foreign body further into the canal or by the instrument used during removal attempts. Foreign bodies in the eye include bugs, dust, sand, hair, debris, and chemicals in the eye. Signs and symptoms: you have scratching, irritation, pain, blurred vision, and tearing. This particular one, this nail chip, is a foreign body in the iris. This patient was hammering a nail and was stuck in the eye by a chip from the nail. Foreign bodies in the nose. This is any object that is causing an obstruction in the nostrils should be removed. Common objects that become lodged in the nostril are cereals, dried peas or beans, grapes, or pebbles. Now we're going to talk about thermal insults. Thermal insults can be caused by either heat or cold. Injuries, burns or frostbites conditions are hypothermia, hyperthermia, heat stroke, or heat exhaustion. Burns are the result of thermal insults to tissues. Causes: heat sources in the form of dry heat, steam, hot substances, or sun rays. Chemical sources, electrical sources, irradiation. The depth and thickness of the burn must be assessed to determine the amount of nerve damage. So we have a superficial burn. This involves only the outer layers of the skin. You have erythema, and they're painful. And the erythema, remember, is redness. So this is like a sunburn. A partial thickness burn extends into the dermis. You'll have blisters, as you can see right here, and they're also very painful. You may also see them as a second-degree burn. And the full thickness burn involves both the skin and subcutaneous tissue. There's minimal pain due to the destruction of nerve endings. And you see how it's just burnt right here. Okay. And so this is also called a third-degree burn, and a fourth-degree burn is a full-thickness burn that extends into the muscle and bone. I don't know if y'all can hear my cat, but she's telling y'all hi. Okay, this is the rule of nines. This provides a fast and fairly accurate calculation of the TBSA, which is the total body surface area involved. Okay, and as the burn size approaches 15 to 20% of the total body surface area, shock sets in if the patient does not undergo fluid resuscitation. So the rule of nines, okay, so the head in total is 9%. The anterior trunk is 18%. Okay, the posterior trunk is 18%. The perineum is 1%. The front of the legs are 9%, and the back of the legs are 9%. Okay, and each so the front of the arm is 4.5 and the back of the arm is 4.5. Okay, so the entire arm is 9%. Okay, so let's say you were assessing a 40-year-old female for percentage of burned tissue. Looking at her, you notice that the following areas are burned. So we have the back of the head, which is 4.5%, the posterior trunk, which is 18%, the entire left arm, okay, which is 9%, and the back of the left leg, just the back, which is 9%. So if you add it all together, 40.5% of the total body surface area is involved, and that's pretty extensive. All right, electrical shock. This is an injury that occurs as the result of exposure to or contact with electricity and constitutes a life-threatening emergency. The signs and symptoms are visible burns at the entry and exit wounds, may be in cardiac arrest or respiratory failure. So, I found this information. The maximum let-go thresholds for a male, it's 15 milliamps, and for a female, it's 9 milliamps. The let-go threshold is the current level where we lose control of our muscles and electricity causes our muscles to contract until the current is removed. The electrical current follows the path of least resistance through the body, usually along the nerve roots. Now, lightning injuries. These occur when individual is struck directly or indirectly by lightning. The 5 ways lightning strikes. There's a direct strike, a contact strike, side flash, stride potential, or ground current. Extreme heat or hyperthermia. Hyperthermia occurs when a patient's core body temperature is much higher than the normal body temperature of 98.6 degrees Fahrenheit. Causes prolonged exposure to extremely hot temperatures, which lead to heat stroke, in which the core temperature is greater than 105 degrees Fahrenheit. Heat exhaustion, where the core temperature is normal or decreased. It happens. This heat exhaustion happens prior to a heat stroke, and it's less serious than a heat stroke. The body temperature is cooler than a heat stroke. Okay, then you have extreme cold, which is hypothermia. This is a generalized cooling of the body in which the core body temperature drops below 95 degrees Fahrenheit or 35 degrees centigrade. It's caused by prolonged exposure to wind, cold weather, or cold water. As the body temperature drops, the person experiences confusion, stupor, and unconsciousness. Severe hypothermia is less than 82 degrees Fahrenheit. Okay. So frostbite is a disorder of the skin and underlying tissue caused by exposure to the extreme cold and freezing of the tissue. The freezing of exposed tissue results in the formation of ice crystals inside the cell wall. It usually appears on the face, ears, fingers, or toes. So this first one right here is first degree, and that's the epidermis is reddened, swollen, and may look waxy. Loss of sensation in affected area. This is the second degree, which is a superficial frostbite. The skin is reddened, swollen, and blisters form that are filled with clear or milky fluid. This is the third degree. Blisters are filled with blood and skin begins to turn black. And the fourth degree, epidermis, dermis, and underlying muscles, tendons, and bones are damaged. The treatment of frostbite. You want to remove the person from a cold environment. For superficial frostbite, you want to warm the victim with an external source of heat, but not above 105 degrees Fahrenheit, and never rub the affected area. So for deeper frostbite, you have rewarming of the tissue should not begin until professional medical care is available. Keep the patient warm, monitor vital signs, and never give alcohol. Now, the diagnosis, there's something called technetium scintigraphy. The extent of it diagnoses the extent of soft tissue damage following frostbite. Radioactive technetium is administered intravenously. The radioactive element is taken up differentially by healthy and damaged tissues. The pattern of hot spots and cold spots, as traced by a scanner, allows the doctor to tell whether and where deep tissues have been damaged by the frostbite. And that's the end of part 1.